joined in our radio car by the Chief Executive of Colchester, Nick Hume. The hospital has actually been in special measures for 2 years. He joined in May to turn it around. And also in Blackburn is Amanda Doyle, who co-chairs the NHS Clinical Commissioners. She herself is Chief Clinical Officer at Blackpool CCG. Good morning to you both.
Morning.
Good morning.
Nick Hume, we were hearing there about that sort of red to green system, changing in the way that you do things in Colchester. What difference can those sort of things make to the particular problem that we're talking about here, of sort of the NHS at breaking point?
So I think it can make a huge difference. We saw in Colchester last week that this system, which has been used nationally in many hospitals with particular success, once we've implemented that with the support of the clinicians and everybody pulling together, working together for the good of the patients, we have seen that we've discharged patients earlier and therefore created that capacity which allows us to treat patients safely in a timely manner, both in A&E but crucially on the wards as well.
Okay, so given what you're hearing from Chris Hobson, is he over-egging the pudding? I mean, is it not as bad as he's talking about?
No, I think clearly there are significant challenges to the health and social care system nationally, and often that additional pressure, wherever you see it in primary care and social care, manifests itself in what appears to be hospitals that aren't coping. But that's often because that's where patients end up if the rest of the system is under pressure. I think clearly we are facing enormous increase in activity. More importantly, patients are sicker, they're older, they're more complex patients, and everybody, managers and clinicians, are working incredibly hard, both within organisations, but crucially across the system as well. The new A&E delivery boards, which have been set up in the last couple of months, bring all the system together to look at the pressures right across and to find solutions. So everybody is pulling in the right direction to try and find solutions to this increased activity, as well as trying to manage the financial challenges as well.
Indeed, but do you come to the point that he has come to, which is something's got to give? You either have to put much more money in than is currently planned, or you have to do less.
There's no doubt that something has to give. I think the systematic redesign of health and social care is essential. The NHS was designed in 1948, where the life expectancy was some 20 years less than it currently is. So without a radical review of the services that are provided, making sure that we're investing in the right areas, making sure there's increased investment in social care, primary care, community care, to take pressure off hospitals, to reduce admissions, but also to make the length of stay shorter in hospitals, will allow us to address this surge of activity that we're seeing.
Okay. And Amanda Doyle, for you, given that you're at that point of effectively of commissioning and deciding what to commission, what gives? What should the NHS not be doing that it is now?
Well, we've got difficult decisions to make. We've always had to make tough decisions about what we do within an allocation, but with these unprecedented financial pressures, it becomes more difficult. The important thing is that we increase our focus on prevention, so we reduce the ever-increasing demand, so reducing smoking rates, getting people to lose weight, reducing alcohol consumption. That needs to be our priority. We need. And
sorry, forgive me for interrupting, but is one of the ways to do that to start saying, look, if you smoke or you are overweight, we will perhaps not treat you?
No, that's not a way at all. What is important is that if you are very overweight or you smoke, your outcome from an operation will be much worse. So it's worth introducing a small delay to help people stop smoking or lose weight first. But what we're saying is not that we will reduce treatment that people need, but we will look at the way we do things to make them as cost effective as possible, and particularly that we won't use evidence to offer services which the evidence shows are not clinically effective.
Such as what? What would you point to at the moment that the NHS is doing that's mad?
Well, it's not mad.
You said it's, sorry, when you're thinking about what is not cost effective.
So there are some interventions which don't either increase people's life expectancy or reduce symptoms particularly. So things like removal of benign skin lesions, things like some cosmetic surgeries, tattoo removal, reversal of sterilisation, body contouring, things which don't show any evidence that they contribute to improving health outcomes. And so those are the things that need to give first.
Okay, is the NHS currently paying for something like body contouring, which presumably is an entirely cosmetic procedure?
In some places there are some procedures which are largely cosmetic being carried out in some circumstances, although most CCGs now have protocols which they adhere to reduce those things.
Let me bring Nick Hume back in here. What is it that you would say, look, we shouldn't be paying for this?
So I think it's difficult. It's a commissioning decision, but I think there does need to be a much wider debate with the public about what's the NHS that we can afford going forward. I think also we need to look very carefully at some of the hospital activities. A lot of follow-up patients that come back for a follow-up appointment following, for example, surgery, just to make sure that they've recovered okay. There might be different ways of providing good outcomes, safe care, without people having to physically come to the hospital. And of course, looking at the use of technology, that most industries, the rest of our lives are run on smartphones, and when we do need to think about whether or not greater investment in technology will reduce the number of people that have to come to hospital and therefore reduce the cost for that care.
So it's about delivering the same care but in a different way. Do you think, Amanda Doyle, that we're at the stage where perhaps things are so bad that we need to start thinking about charging some people for some things?
No, I think we're at the stage where we need to think about the way we do things and make sure we do it cost effectively, using technology, making sure that people manage minor self-limiting conditions at home. We need to particularly focus on social care, so the cuts in local authority budgets affecting social care and public health services are having a devastating effect on the NHS, and it's really important that we address some of those issues.
But ultimately, it is still at a point, because the warning from Chris Hopson is very stark language, almost of collapse. Is that something that you have? Is that how you would characterise it, Amanda Doyle?
We will not remain financially sustainable if we continue to deliver care in the same way as we do now, as demand rises. But we need to take action to adapt the way we do things, to rationalise the way we deliver some back office functions and non-clinical services to ensure that the medicines we use are the most cost effective ones. We may need to consolidate some services to reduce costs, and particularly again improve the funding for social care to enable us to get people looked after better in their own homes, so we're less dependent on a hospital.
And a quick thought, the 7-day NHS, which Chris Hopson says is impossible.
Well, it's really important that we differentiate between 7-day services that are needed for people who are acutely ill, who need to receive the same service over 7 days, and 7-day services which are purely for convenience. It's really important that we do the former. The latter is probably less of a priority in the current circumstances.
Amanda Doyle, Nick Hume, thank you both.
The time, 22 minutes past 8. How much detail should politicians know if they're going to do their job properly? For instance...